Fallout tonight from a KARE 11 News investigation into the Minneapolis VA Medical Center. Our report got the attention of a Minnesota congressman. Last night, we showed you how fraudulent medical records could be putting the health and lives of local veterans at risk.
AJ Legault gave us the exclusive report last night, and he's here now with an important follow-up. AJ?
Randy, Julie, today we heard from Minnesota Congressman Tim Walz responding to our investigation. In a letter to the acting inspector general of the VA, Walz writes, "If these allegations prove true, I was not given the full story from VA officials during my visit to facilities and during numerous interactions since. I'm requesting verification that the allegations from the story are being fully investigated by the inspector general." Now tonight, our investigation continues as we hear from a veteran who pulled his own medical records to prove just what's going on.
There's trust. It's a matter of trust.
Ernest Jones, a Vietnam-era vet, says the Minneapolis VA violated his trust, breaking its own rules when it comes to patient care.
They lied. You know, the people that did that lied.
Jones' medical records show his doctor ordered a colonoscopy for him through the VA's gastroenterology department. They say Jones was supposed to get a letter explaining the importance of the exam and giving him a number to call and schedule the procedure. It's a letter Jones says he never received.
Never got a letter?
Nope.
Nothing.
Nothing. Nothing at all.
That's not surprising, according to both of these former VA employees who helped schedule colonoscopies.
Some patients don't even get the letter that is supposed to be going out.
As we've reported earlier, Letty Alonzo and Heather Rossback have filed this official complaint with the VA's Office of Inspector General, claiming that while working at the Minneapolis VA, they were ordered to falsify patient records, like Ernie's, to make it appear the GI clinic was meeting its performance goals.
And it's all about making the numbers look good, regardless if it's damaging people.
Straight up, you lied on documents?
Yes, I did.
Not only would letters not get sent, the women claim they were ordered to lie by putting in the computer system that veterans had been notified they needed medical care when they'd never been contacted.
They should be getting treatment, obviously.
Yes. But not knowing, how can they?
So what happened to Ernie's colonoscopy appointment? Well, Ernie's not just a vet. He also works for the VA.
Well, I've got, I didn't say I was, I have 29 years federal service.
And last December, he says he went to visit an old friend, Letty Alonzo, who'd just been transferred into the GI department.
And I said, well, I was due for one, but I never got a call.
A check of Vista, the VA's computer system, revealed the truth. His colonoscopy had been canceled.
I just really was blindsided by it.
Jones' records show that 3 months after his letter was allegedly sent, his colonoscopy was canceled because he didn't call in. That's a violation of VA policy.
We're supposed to call them.
That's right. In black and white, VA guidelines state you must call the patient to ensure the patient knows about the appointment.
If it happened to me, believe me, it's happened to quite a few other people.
Letty Alonzo says she was just beginning to discover what she describes as corrupt record keeping, designed to hide massive backlogs and delays in patient care.
I tried.
Emails show Letty tried, with Ernie's help, to get the situation fixed internally.
You tried going through channels to get this fixed.
Yeah. I moved almost heaven and earth. In fact, I even sent an email to the chief of staff.
This is that email directed to VA patient advocate Michael Rosecrans and chief of staff Dr. Kent Crossley. Jones thanks them for listening to Miss Alonzo's issues, including delayed consults that could involve life-threatening issues. A week later, Jones sent another email to Mike Rosecrans saying one of the patients was noted as having cancer symptoms. You sure as hell better hurry and do something.
They never responded.
The delays Letty and Ernie were concerned about are very similar to what in April the VA found contributed to 23 deaths at a dozen other VA facilities nationwide. Ernie wrote Letty an email saying, "We did the right thing," telling her if those problems were not reported to leadership, you could have gone to jail.
And I felt confident that everyone was going to come forward and say, oh my God, this is really going on, let's fix it.
But the VA apparently determined the appropriate fix was to fire Letty and Heather.
We spoke up, and as you can see, we're no longer there.
The women claim they were fired for trumped-up charges. Minneapolis VA Director Patrick Kelly said he couldn't discuss Letty's case.
I'm saying that her
And I'm going to talk about it generally because I can't talk about personnel actions.
But this letter says the Minnesota Department of Employment reviewed Letty's case and found there is no evidence to support the VA's claim she did something wrong.
And what about the whistleblower's claims about a big backlog of patients waiting for appointments? VA insiders tell KARE 11 there's currently a massive effort underway to go back and quietly identify veterans like Ernie who had their medical appointments improperly canceled and begin trying to reschedule them. Sources tell us so far they've identified more than 300 cases.
But when we originally questioned Patrick Kelly,
are there currently significant delays that you're trying to catch up on now?
No.
he told us he didn't know anything about it.
Is there any push right now for overtime or anything else in that GI department to get caught up on consults?
Not that I'm aware of.
But these two internal VA emails from July and August, before our interview with Director Kelly, show a supervisor was asked for volunteers to work overtime to help out with GI consult scheduling to make sure patients are contacted and scheduled. And the catch-up is still underway. This email shows they're trying to get 7 people to work overtime this coming Saturday, September 6th, scheduling for GI.
Well, I guess I shouldn't ask you because you're not the VA, but what's going to happen with this? I mean, is anybody going to do anything?
That's really the million-dollar question. President Obama just told veterans last week that when stuff like this is discovered, the people responsible will be held accountable. And Congressman Walz said the same thing to us in that letter. If you want to read the entire letter the Congressman sent to the Inspector General, you can do so at KARE11.com.
Tonight at 10, new developments in a KARE 11 News investigation. Could your tax dollars be paying for big bonuses based on falsified records?
That's what A.J. Legault is exposing tonight as he continues to dig into the local Veterans Administration, and he has more on that. A.J.?
KARE 11 News has learned that the FBI has already started interviewing whistleblowers who claim that patient records were falsified to cover up life-threatening delays. The question now, were some top VA officials here and across the country raking in big cash bonuses based on those phony numbers?
He died while the Minneapolis VA made him wait to see his doctor.
70 days just is too long.
And adding insult to not just injury, but death, VA records claim Marine Corporal Jordan Beisman contacted them from the grave to ask for a further delay. Beisman had epilepsy and was suffering from seizures. His last would be fatal. An independent expert says Beisman could have been saved if he'd been seen more expeditiously.
I think it's shameful that people have cooked the books and done other things to not serve veterans.
Since our report on Jordan Beisman's death first aired, there's been a national outcry.
And we are not going to stop.
From veterans groups to Congress.
Corporal Beisman and listening to his mother, it'll break your heart, as it should, and it shouldn't, it doesn't have to be this way.
This way. A way that, according to the VA's own memos, includes cooking the books by canceling appointments and falsely claiming it was done at veterans like Jordan Beisman's request, all in order to create a false impression of quality, timely health care for veterans.
He was only 25 years old. He deserved to live his life.
How did it get this way? VA whistleblowers sum it up in one word.
Bonuses.
Bonuses Congress felt were so extravagant they held a hearing on them in June.
We're going to examine the outlandish bonus culture at the VA.
The VA was awarding bonuses in part based on how well hospitals met scheduling standards. The standard used to be 30 days to get a veteran a medical appointment. In 2011, that standard was shortened to 14 days. And that's when the train seems to have left the tracks. In late June, White House staff presented President Obama this report detailing the VA's corrosive culture. The report says the 14-day scheduling standard may have incentivized inappropriate actions. May have?
It's more about numbers.
Try definitely did, says former Minneapolis VA employees.
Numbers is all that really counts, not the veterans' lives.
Patients became numbers, and numbers translate to dollars in the pocket.
According to VA's own data, over $2.8 million was paid out in performance awards to senior executives for FY13.
That's just last year. KARE 11 obtained VA data for the past 7 years and found nearly $23 million in bonuses paid to top executives. But now the question is, how much of that was awarded based on manipulated data?
We were being instructed to manipulate and continue the manipulation. And
So who made the most in bonuses? Here in Minnesota, no one comes close to this woman.
So I'm Jan Murphy, and I'm the network director for the VA Midwest Healthcare Network.
Janet Murphy oversees VA hospitals across the Midwest, from regional headquarters in the Twin Cities.
And I am accountable for what happens in this network.
On top of her $176,000 a year salary, she's made $99,465 in bonuses since '07.
And $100,000 as a bonus to retain someone who's not seeing veterans, you find somebody to me who can justify that.
We wanted to let Murphy justify it. At a recent VA town hall meeting, she said this.
I talk to anybody who calls me.
But when we called,
Janet Murphy, please.
we were told she was not available and would likely not be available at any point to talk with us. The former Minneapolis VA director, Stephen Kleinglass, was another recipient of big bonuses. He was paid a salary of $180,000 a year, and from 2007 to 2010, he received $76,000 in bonuses. He retired at the end of 2011 and was given an additional award of nearly $63,000.
And the VA is continuously saying we need more money. We need more money for more doctors. We need more money for more nurses. We need money for computers. You've got money.
The House Committee on Veterans Affairs provided us with figures showing the VA awarded to all of its employees more than $278 million in bonuses and various incentives in 2013 alone.
If those bonuses were given out, taxpayer money, under false pretenses, when in fact records were being doctored or wasn't true, I don't think that's right.
Senator Klobuchar is now the co-sponsor on legislation receiving strong bipartisan support to make VA employees who receive bonuses pay them back if it's shown they contributed to falsifying waitlist records.
We're going to have to get that money back if it's proven that they did that.
While some of the bonuses may end up being paid back, what can't be given back is the days and weeks and months veterans have been forced to wait for care. Some of them, like Jordan Beisman, couldn't wait.
I miss hearing his voice.
Long enough.
Sorry.
In one of his last actions before resigning under fire, former VA Secretary Eric Shinseki suspended the awarding of bonuses for 2014 and ordered that patient wait times no longer be a part of employee performance reviews. Julie?
Well, we did talk about the former Minneapolis VA director and his bonus. The current director, was it suspended before he was able to receive a bonus?
Well, yeah, he actually has not received any bonus. Patrick Kelly is the current director over at the Minneapolis VA. He was appointed in June of 2013, and there's no record that he's received any of the performance bonuses that are now in question. I can tell you this, right before I walked in here on set, I learned that the FBI will be interviewing additional Minneapolis VA employees tomorrow.
All right.